Shoulder pain can be very frustrating. It usually starts as a dull ache. Soon you realize you are unable to lift your shoulder properly, reaching behind your back becomes impossible, and even lying down at night makes you very uncomfortable. One of the main causes for this is a rotator cuff injury. I am Dr. Belliappa, an orthopedic and sports surgeon, and I am here to explain to you what a rotator cuff injury is and how one should manage it. The rotator cuff is just not one muscle. It is a group of 4 muscles and tendons that wrap around the shoulder joint. Think of them as your support system that helps keep the shoulder stable as you lift, rotate, and move the shoulder in all directions. Without them, even simple activities like combing your hair or wearing a shirt can become a difficult task. Now, how do these injuries occur? For many people, it is usually slow wear and tear. Age plays a role, and poor posture while sitting on a desk for long hours adds that additional strain on the shoulder. And repetitive overhead movements in sports like badminton, tennis, swimming, and bowling add additional stress on these tendons over time. On the other hand, injuries can also happen suddenly, like if you slip and fall, or if you carry a heavy object awkwardly, or if you dislocate your shoulder. Certain medical conditions like diabetes or even smoking can reduce the blood flow to the tendon, making them prone to injuries and tears. So how do you know it is a rotator cuff tear? The pain is usually deep-seated and not at the surface of the shoulder. The pain tends to get worse at night, especially if you sleep on that side. You may notice weakness when you lift or rotate the arm. Some people also hear a clicking or a popping sound. The most important thing is, if the pain does not improve over a period of few weeks, this should not be brushed aside. Let's talk about what one should do if you suspect a rotator cuff injury. First aid makes a big difference. Rest your shoulder, avoid lifting heavy weights and overhead activities. Ice packs can help reduce the pain and inflammation if the injury is recent. Don't try to push through the pain or test your shoulder via forceful movements. That can make things worse. You can support the shoulder in a sling for a short duration of time, but prolonged immobilization is not advisable as stiffness sets in. Over-the-counter medications may help, but remember, it will only help alleviate the pain but does not tackle the underlying problem. When it comes to treatment, mild injuries usually respond well to physiotherapy. A trained therapist will guide you through a set of exercises which strengthens not only your rotator cuff but also the surrounding shoulder muscles and the back muscles. This improves stability and reduces the strain on the rotator cuff and the shoulder. For moderate injuries, we usually use a cortisone injection which helps reduce the inflammation and pain, or newer options like PRP where your own platelets are used to help healing and reduce the inflammation. If there's a complete tear or the pain persists despite conservative management, surgery may be required to repair the tendon. The type of surgery depends on the size of the tear and your activity level. These surgeries are usually performed via a minimally invasive technique called an arthroscopic procedure. Recovery is not overnight. For mild cases treated with physiotherapy, it may take a few weeks to a few months to regain complete strength. After surgery, the usual recovery is 3 to 4 months, but it may take as long as 6 months to a year to regain complete strength. The key is patience and consistency with rehabilitation. A few do's and don'ts are worth remembering. Do start gentle mobilization of your shoulder once your doctor advises. Early movement can help prevent stiffness. Do follow your physiotherapy program regularly because that's what's going to build your long-term shoulder strength. Don't ignore pain and don't continue playing or lifting weights. This can make the tear worse. Don't rely only on painkillers to see you through the day because they can hide the problem as the tendon damage progresses silently. So if shoulder pain is interfering with your daily activity and sleep, don't wait it out. Get it evaluated. With the right diagnosis and treatment, most people recover well and go back to all normal activities. If you found this video helpful, give it a like and share it with someone who's been struggling with a shoulder pain.